This segment of Delmarva Life is brought to you by the Baltimore Ketamine Clinic.
Using the science of psychiatry and anesthesia to help improve people's quality of life. That's what happens at Baltimore Ketamine Clinic. And as its name suggests, the clinic began across the bridge and later expanded here to the Eastern Shore.
Co-owner Ivana Mitic says this is a groundbreaking treatment for those who suffer from the treatment-resistant depression. Delmarva Life's Katie Zerilli takes us to the location in Salisbury and finds out how the process works.
For Ivana Mitic, treating people's pain is a passion.
The best part for me is that the people get better, and they get better really rapidly.
She does so by using ketamine, which is an anesthetic that was approved by the FDA in 1970. It's administered here at the Baltimore Ketamine Clinic in small doses, 40-minute infusions.
It increases dopamine levels, it improves the function of the nerves, it regrows new receptors on the nerve endings in the brain. But one of the things that I find really fascinating with ketamine is that the experience that it provides during the infusion, which is called dissociative experience, that really provides the space for healing, where ego is not really involved in the thought processes, and it's the kind of like time where people can forgive, where they can get different perspective on things.
Ivana says this medicine is mainly for those with suicidal thoughts, anxiety, depression, post-traumatic stress disorder, or obsessive-compulsive disorder who've tried other treatments that haven't been successful.
The majority of people that we see are the ones who have pretty much lost hope, and they're really looking for something that can drastically help them feel better.
The ketamine is administered here in these relaxing rooms over a series of appointments.
The standard protocol is 6 infusions. And then after we're done with that, they come back for one treatment as needed. One of the patients that I've had, this was recent, he was in his 70s, and he completed the initial series, which consists of 6 infusions. And then we didn't hear from him for a while. So he came back a few months later and he said, I'm just coming for like a booster touch-up infusion. I'm getting ready to go out of town. And he said, this is the first time that I've felt good in my life. And I've tried, all the medicines and stuff. And he was 70, and it kind of made me tear up, and because it's such an honor to be able to do that for patients, truly.
Especially because mental health matters hit close to her heart.
When I lived in Serbia, one of my first friends, he was a guy that I played basketball with. He was from my school. He was the first friend, who brought me flowers that he picked up on the way to my house, to visit one day. He shot himself.
And that wasn't the only life lost.
Soon after that, I had another friend who was a little bit older hang himself. So, just this way, it's almost like giving back for them too. And I couldn't help them, but, I can help other people. And also, I do want to make my community better.
Ivana started studying nursing in high school and continued through college. She then got her master's in anesthesia and her postmaster's in psychiatry.
I used ketamine extensively in the operating room, and that's how I was comfortable to start doing it. And then also, having the anesthesia background and monitoring the patients in the operating room and stuff, it just kind of translated to actually a lot easier and safer model of administration.
Even though it's a ketamine clinic, they've got other services too. Michelle Ridgway is a psychiatric mental health nurse practitioner.
We are offering psychiatric care because we do also understand that there's a lot of people who can't access psychiatrists or psychiatric nurse practitioners down in this area. So Michelle has been a psychiatric nurse practitioner for a few years, and before that she worked as a nurse in psychiatry for many years. She has done some inpatient and outpatient work as well, so she is pretty experienced, and she is available and taking new patients.
They're also introducing Spravato treatments.
We are starting to offer Spravato, which is the nasal spray that was FDA approved about 3 years ago. So this is something that is also administered in the office and that has shown good results. We're supposed to start rolling that out in beginning of July, right? So that works a little bit different, and people would come in, they have like 8 treatments the first month, 4 treatments the second month, and then a couple of treatments the third month. It is a little bit slower than ketamine, but it does show good results and insurance covers it, right? So that was the service line we really wanted to bring in to increase access, because it is still, more effective than a lot of the medications.
The main goal with any of these treatments is to improve folks' quality of life, which Ivana says will have a ripple effect.
I feel like when we can help one person, we're helping their families, their friends, their kids, their co-workers, and it essentially works. It's a domino effect, and it makes the community better.
Hope for healing can begin right here.
Now, if you're interested in finding out more and hearing patient testimonials, you can do that on Baltimore Ketamine Clinic's website. Of course, we've got a link on Delmarva Life to take you there and find out more.
Yeah, interesting reading indeed.
Yeah.